Welcome to another informative video from Swindon Chiropractic Clinic. Hello and welcome back to Swindon Chiropractic Clinic. Now we've all heard the term RSI, but what exactly does it mean? Well, I'm here to talk to James Forrester Wood to find out more. Well, hi James.
How are you doing there?
First of all, tell us exactly what is RSI?
RSI is something called repetitive strain injury, and it basically occurs more commonly in the upper limb but can be seen lower down as well. And it is a result of repetitive action through a particular part of the body, and that results in inflammation in the tendons and the muscles and can cause quite a considerable amount of pain.
Now we've all heard about tennis elbow, but I understand tennis elbow isn't just about tennis.
Yeah, tennis elbow is a description that was used by GPs a fair few years ago, but nowadays it's more commonly seen in industrial settings or sat down behind a desk when you're doing a repetitive action, working on the keyboard or on the mouse. So it doesn't matter how you do it, as long as it's a repetitive action or using machinery that vibrates or any other machinery like that which will cause problems. I'll just show you on this mannequin what we're actually dealing with when we're talking about tennis elbow. If we look at the anatomy here, you've got two bony prominences on the bottom of the arm bone here. Your muscles are attached onto here by tendons and go across this area through the forearm onto the wrist as well. When you're looking at tennis elbow, you're looking at irritation of these structures here and irritation through the tendon. Now, on yourself, if you could roll up your sleeve there, we're looking at, in particular, this muscle group just through here. These muscles attach onto this bony prominence here, and when you get tennis elbow, this is the area that's affected, and that can cause pain and disruption down into the forearm as well.
So James, we're here at a typical workstation. Maybe you can give me some practical tips on how I could avoid RSI.
Now when you're sat at a workstation, the most ideal thing to do is try and maintain a nice 90-degree angle at the elbow. Now to do that in this situation, you need to bring the keyboard forward. Ideally you should have a nice wrist support there to help maintain a nice neutral position in the wrist. Also you need to move the mouse forward as well. Again, that's maintaining that nice 90-degree angle. You often see tennis elbow present when people are using the mouse in the wrong manner. In other words, they're overextending, putting pressure through the elbow, and hence the problems build up from there as well. Right. Looking at this workstation, moving the phone forward as well, and avoiding the old habit of putting the phone receiver into the crook of the shoulder, because that in itself can cause problems with the neck and the shoulder as well. Ideally, you should get up every half an hour, move around and walk around as much as you can, just for a minute or two, just to break down the tension of being stuck in one position, and then sit back down and get back down to what you're doing before. We have two main types of treatment that we can use. First of all is mobility and mobilisation of the structures which aren't moving properly. And second of all, we concentrate on the muscles, tendons and ligaments across that area. So we do some deep tissue work, medical acupuncture and some general mobilisations, and that will help to reduce the restrictions in the muscles and the tendons.
Now here in Swindon, of course, we've got a lot of manufacturing companies, and I understand people who work with machinery can also be exposed to the symptoms of RSI.
Yes, I mean, in industrial settings, if you're working on manufacturing processes, you're often using heavy machinery that vibrates, and a repetitive sort of use of those machineries can cause the inflammation to the tendons and the joints as well. So just trying to use those in the correct manner when possible, and also receiving treatment will help to alleviate those problems.
Well, James, thank you very much indeed. That really was very, very helpful, and I really feel I've got a better understanding now of RSI. And you can find out some more information and advice from the Swindon Chiropractic Clinic, where you'll also see some great videos as well. We'll see you soon.